Hi, and welcome back to the show, Examining Medicine from Traditional to Alternative and Beyond. I'm your host, Dr. Franchell Hamilton, and we are in the Limelight TV. I am so excited for our guest today. It's perfect timing. Dr. Roseann, she is a trailblazer in the mental health space and founder of Global Institute of Children and Mental Health. She is currently the author of the book It's Gonna Be Okay, which I cannot wait to hear about because it's perfect timing. Today, we are going to talk about what is the long-term impact of the pandemic on mental health. There's been so much going on with mental health and a lot of stress and anxiety surrounding that. So why not bring an expert who can kind of shed a little bit more light and tell us what we can do, not only for ourselves, but also about our children. So hi, and welcome to the show.
Well, thank you for that lovely introduction, Dr. Franchell. I am so grateful for this conversation because without good mental health, nothing seems to matter in the world. And there's so much we can do to improve our mental health. And I really am on this mission to bring hope for people who feel like they're stuck and they don't know what's next.
Yeah, no, I think it's perfect. So, per the title of our show, what have you seen, or what do you think has been the long term? What do you think is the long term impact of this pandemic
Yeah.
on mental health?
Well, here we are over a year into this pandemic, and there is research actually coming out of Asia and Europe and the United States that's already showing us the long term impact during this year span. And no surprise, there is an uptick in anxiety and depression.
Mhm.
I think one of the most surprising statistics through survey research with kids in the United States is that 50% of kids in the United States who had a family member with COVID have moderate to significant depression.
Oh, wow.
And with rates of COVID through the US, I mean, there's some areas that are spiking, but overall generally declining. Um, but we've had, I don't know what our numbers are today of the million plus people that have had COVID.
Yes.
But that means a lot of people are going to be impacted, and not everybody gets COVID and is okay.
Yeah, I agree.
Lots of deaths. I mean, at my center, less than 20 employees, we had 3 staff members lose a parent.
Oh my gosh.
Right. And
That's
so
horrible.
that's very, very difficult. And so then there's the group of people that have, the long hauler symptoms, or even just being afraid that you're going to get sick has a
Yeah.
trickle effect. From a clinical standpoint, we're seeing anxiety, depression, suicide rates go up, not
Ugh.
just for kids, but adults. And then
Yes.
on the non-clinical side, I think everybody is overwhelmed.
Yeah,
I
no,
mean,
I agree. And
right?
not to even mention the financial and the people who've lost their jobs or their business closed. I mean, it's had such a not only a health impact, but such a large economic impact. And now it's really ripping into I think, the mental health. I
Yeah,
agree.
I mean, it's not just the stress of the disease. There's serious
Yes.
impact on people's, livelihood, the way they're working, where are they living, are they getting food on the table?
Yeah.
And in all of this, we know through the American Psychological Association does a Stress in America survey every year, and
Okay.
parents, this is not surprising, are reporting 70% of all parents are reporting a significant level of stress due to homeschooling and working from home.
Yes.
Right. So we have
Yes.
just people are stressed. And I think just the culmination of the pandemic, racial tension, the election, I mean, it was like bam, bam, boom. Everybody felt
Yeah.
really kind of walloped. Some people are sad, some people are withdrawn, some people are getting through it, and some people are really easily angered and irritated about what's happening in the world. And so it means on a day to day basis, they're showing those signs of irritation, which is a lot of friction with other people.
Yeah, and I think we're all seeing that. So you are currently kind of jumping in and dealing with it. And I just want to acknowledge being a physician and having worked on the front lines with the pandemic. I think mental health and those mental health workers also need to be recognized. I will be the first to admit during this whole thing, I don't feel like it was as recognized. Everybody kind of
Come
recognized
on.
the, EMT, and I get
Gross.
it. All that's important. But the aftermath of this, it's going to be you guys that are helping kind of almost like pick up the pieces. So currently, you do integrated mental health. So I want you to define what that is. And second part of the question, how are you or what are you doing in your practice to help with what you just discussed?
Yeah, thank you. So, I call myself an integrative mental health expert
I love that.
because this is my 30th year in mental health, right?
Wow.
And I am so grateful because I really have worked with thousands of people over these years in a lot of different ways, right? In residential treatment centers, in schools, and in private practice for a long, long time, and through consultation. And, what does it mean to be integrative? Well, I almost hate, I'm using the word hate, that when I talk about what I talk about in you asked what I'm doing a summit. I have a book called It's Gonna Be Okay. But in all my practices, I bring in evidence-based approaches through mental health. And I am a research nerd times 10. Okay. And integrative means that you are using tools on both the Western and Eastern side. Now, for some reason, things like nutrition, supplements, exercise, meditation
Yeah.
somehow have become integrative. Okay. Why? I
Yeah.
kind of have an idea. It's called Big Pharma, but we won't go there. I think ultimately what it's about, you talked about me being a frontline worker, right? What happens to people when they have physical problems or things that nobody can figure out? Where do they end up? They end up with mental health providers. So 30 years
Yes.
ago, I was always holistic. I'm the daughter of Italian immigrants, so food is medicine. So I didn't know that you shouldn't be talking about how there was a connection to what you put in your mouth to how your brain and body works. It's called science. But
Yes.
when
Yes.
right? Exactly, right? So, but when we talk about mental health, right, I've always had cases that were complex. And what does that mean, complex? You probably know this, Dr. Franchell. It's people that have had treatment failures. And in mental health, the standard of care is one standard of care. You have a problem, you're going to be told to take a pill, or you're going to be prescribed talk therapy. And I'm going to tell you both of those at this time are pretty ineffective. I do very much believe in talk therapy, but we have to look at science. And what does science tell us?
Yeah.
Our science tells us that when the nervous system is stress hyperactivated, you are not accessing your cognitive powers. Your frontal lobes go offline. You're not able to process information and thereby take action when your nervous system is activated. And I'm here to tell you, and everybody who's listening knows this, what is happening in the world right now has an effect on everybody, and we are all stress activated. But there are many ways to mitigate that, whether you have a clinical issue or not a clinical issue. So integrative is really about using evidence-based tools. And we can't use the word
Yeah.
alternative or holistic, or you can, but really what we should be saying is what I'm screaming from the rooftops is these are things that work. They're natural, they're safe, and they have a lot of research. I mean, my book, It's Going to Be Okay, has over 40 pages of research citations. I don't mess around. I want people to be like, wait a second, I've been stuck. I have anxiety. I have depression. I am not happy. I have a hard time focusing. I can't regulate my thoughts. I have negative thinking. I'm on the worry train. I need something else beside a pill and beside talk therapy because they don't seem to be cutting it.
Yeah.
And I want them to
Yeah.
know
I love that.
there's many approaches that are effective and they need to know about it.
There's many approaches, hence the title of the show. I mean, there is traditional, so you're not saying those don't work. They
I'm not
have
saying
use,
it.
but that's not the
Yep.
answer for everything. So what are some of your natural, just list a couple of natural ways that you help when you
Yeah.
have people in this situation?
So you asked what I'm doing to help people. And one of the ways that I'm helping people is we have this summit, the Get Unstuck Parenting Summit, which is launching this week. And it will be evergreen for people who are listening. But I have my book called It's Gonna Be Okay. What I have laid out for people is I believe in 8 pillars to mental health, to reducing and sometimes reversing mental health symptoms.
Oh, that'd be
Because
great.
how about that, right? We don't even
Yeah.
talk about that. We tell people, oh, genetics define you. It's a biochemical brain imbalance.
Exactly.
And as a physician, it could be a thyroid problem.
Oh my gosh, there's so many other things.
It could be chronic inflammation. It could be a
Yes.
tick-borne illness. There's so many other things. And for people who hear this, they're like, what? Why
Yeah.
am I not hearing this? Well, I mean, I know that I've been talking about it, and that's why I'm always on in the media and doing things, because I want people to have hope and a belief that there's another way. So what are some of these things? So for me, the 8 pillars in mental health are very much the same for physical health. And even though this book is really directed for parents with their kids, it doesn't matter. This is what works for mental health of any age. And it's common sense things like reducing the impact of stress, right? Sleep,
Yeah.
detoxification, genetic mutations, supplements, what you eat, right? And then I'll dive very deeply into parenting and parenting techniques and how you can make little changes to have a huge positive impact on your child, specifically their coping skills. And then I talk a lot about neurofeedback, biofeedback, breath work, meditation. And, people may hear 8 pillars and be like, oh, that's a lot. No, what I want you to know is there's really not a limit in the possibilities. And what works for one person is different. But we do know when your nervous system is stress activated, if you have a physical or a mental health problem, no healing is possible. You
Yeah.
could kind of muddle through, but if you really want to bring daily joy into your life, feel focused, you've got to get that nervous system regulated.
Yeah, no, I agree. So you also talk about there's a difference between stress and anxiety. And I think that's important because some people I feel like may not know the difference. So what are the differences between the two?
I mentioned the stress activated nervous system, and it's important
Yes.
to understand your nervous system to understand the difference between stress and anxiety. So, we have this part of our nervous system, it's called the autonomic nervous system. Its sole job is to regulate the stress response. And we all have stress. And we have the system that works when we, take care of it, right? So it's like
Yes.
saying to your car, you're never going to replace your tires. That's going to mean you're going to have a lot of problems. Every time it snows, you're going to be sliding all over, or it rains. You're more likely to get in an accident. You have to start altering what you're doing because your tires are worn out. It's the same thing
Yes.
with our nervous systems. What happens, right? So we have a relaxed state called the parasympathetic state. I call it the hot tub state. Then we have a stress activated state. It's called our sympathetic dominant. When you're stress activated, you're sympathetic dominant. And
Yes.
so you have a normal stressor. Somebody cut you off in traffic and you almost got in a
Yes.
car accident. And you're driving along, right? We've all been there. If anybody who drives, and
Yes.
you're like, holy moly, I almost just got in this accident. And
Yeah.
you might feel hot. You might feel a pang in your chest. You have looping thoughts. Okay. Well, when you've taken care of your nervous system, okay, you change your tires, your nervous system says, okay, I can go back down and get back into this regulated state. But
Yes.
when we have long term chronic stress or clinical issues like anxiety, depression, even chronic pain or infectious disease, whatever is going on, right? Chronic inflammation, your nervous system is going to start getting into this hyperactive state. And what does that mean? It means that you're actually involuntarily going to be more activated by stress
Yep.
than if your nervous system was regulated, right? And if you just
Yeah.
even think on a regular day, right? Like if you're taking care of yourself, you're sleeping, you're eating well, you're exercising, you have great people in your life, little stressors don't impact you in the same way, right? I'm in the
Yeah.
middle of a launch and I'm feeling it. I'm feeling like, oh boy, like my little cutie pants 10-year-old who is adorable, I just want to say, loves to have chitter chatter with me in the morning. And here I was trying to do some posting and all these other things. And I literally said, hey, JC, mommy's brain is like, and I just help me out. Right. And he's so great. Like
Yeah.
we can joke. I was like, go run in traffic, go play in the street. And he has this great banter, and I use humor to kind of get myself back on track. But you have to pay attention.
Yeah.
So
Yeah.
what's stress? What's anxiety? Okay. So stress is a normal response
So
to
that's
stuff.
stress, like the flight or fight. And now I think we so easily get into it with everything. Like somebody cuts us off, a bad email, a bad time at work. I mean, in this irritation that everybody's kind of going
Yeah.
through because of everything that's going on in the world, a lot of us are hyper stressed, you're saying. Okay.
Hyper stress. So what's anxiety? What's
Yep.
depression? What are these other things? It's when you are experiencing symptoms that are interfering with your daily functioning. Something an hour or more a day, for example, OCD. You're having obsessive or compulsive thoughts more than an hour a day. It's interfering with school or work or your relationships.
Okay.
Anxiety, the same. You're having worried thoughts, headaches, somatic symptoms, whatever is going on. It's got to be interfering. And I think what I really want to say to people, and I mentioned this earlier, is that it doesn't have to be genetic, right? You can have these issues. They
Yes.
can creep up from chronic stress. And actually, don't you feel that it's way more likely to occur from chronic stress than it is from a genetic?
Yes, then it is genetics. I'm glad you're making this point because everybody kind of just labels the receptors and stuff in the brain. Here's some meds, for your depression or anxiety, or like you were saying, and it can be rooted in other things. I think that's a very important point that you
Right.
made.
And when it is stress, when it is rooted in, even if it is genetics, okay, maybe it's a combination, right? Maybe
Yes,
it's your lousy diet. Maybe you're in a terrible marriage. Maybe you have a
yes,
boss that's awful. Maybe your kid is really suffering from being homeschooled and isn't getting proper instruction, is missing all their friends. These are all sources, and a pill doesn't fix it. This is what you need to
yes.
do. And this is my message. And this is what this book literally lays right out for you. And it's going to be okay.
Perfect.
And you can reduce and reverse these symptoms. And it starts first with getting that nervous system regulated. You've got to do things like meditation,
Yes,
prayer, gratitude journaling, yoga, biofeedback, neurofeedback. It doesn't matter what you pick, it's going to be right for you, and you have to be consistent. And
hmm,
you have to stop believing there is something. Then, part two is you have to do some work. You have to, whatever, if it's your negative thought, if it's
yes,
have to stay in this job because you're financially supporting your parents or your family or whatever it is, that's okay.
exactly.
You can find a way to do it. And I think we don't realize the power of our mind, the
Oh my
power
gosh.
of being present in that moment. And, how can two people experience one thing, the
And
same
see it
thing, and have
completely different.
vastly and it's about their mindset. It's about the
Yep.
resiliency they built up within themselves. And that's people need to know they are the CEOs of their own health. And that includes mental health. And there's just so many powerful evidence-based approaches that are not what is being taught to people, right? And
Yeah.
and this as a physician,
Yeah.
most physicians, traditionally trained physicians, have not had one course in nutrition. Is that
Yeah,
true?
that is 100% true. I tell my patients all that all the time. Like, as a weight loss surgeon, they come to me about nutrition. I had to learn it on my own. We do not learn that in med school. And to be honest, we don't learn that much about mental health. We learn depression, anxiety, and bipolar schizophrenia and the different receptors and the pills to treat that. But we are not learning the power of the person's positive self talk, positive input, the narrative that they're telling themselves is more powerful than any pill. We don't learn that. And I think that's huge to get that message out there. So I'm
Yeah,
glad you also
and
agree.
absolutely. And thank you for being so upfront because,
Yeah.
in the world of mental health, the physician is at the top of the chain. And some of my biggest pushback in 30 years has actually been other mental health providers.
Yeah.
The people I work with are like, "Oh, Roseann, you laid out the science. You lay out how you work with me and I feel better." And, even when clients work with me, they have to fill out we're using standardized measures to measure progress and
Yeah.
non-standardized measures. We do Likert scales and things like that. But I want people to understand that power. And I think the biggest barrier to people getting better with me, and anybody can get better except the people that don't believe they can get better. It's
No,
like,
I
well,
agree.
shouldn't I do this Zoloft? Shouldn't I do that? Why? The
Yeah.
research doesn't support it in that. And what is that about? It's about trusting the process and actually doing the work, right? It's
No.
why, French, that I have a magic wand on my desk, because I pull it out in my intakes and let them know it's not happening. There is no
Yeah,
magic wand.
exactly. I love that. I love that visual. So we'll wrap it up, but I did want to ask, because this is your kind of expertise with children. How can I, as a parent, and all the parents in general listening, because I feel like depression and anxiety in kids, my own daughter is struggling with this and she's only 8, has risen over time, a combination of social media, and not to mention the pandemic and everything that they see and don't know how to process in this world. So how can parents help their children kind of manage this mental health? What can we do?
Yeah, I mean, it is on the rise, and you're 100% right. This is long before this pandemic. I mean, things are on an epidemic level. I started the Global Institute right before the pandemic in January of 2020, because I
Yeah.
really am on this mission to give people this information and give hope and show them the way, right?
Yes.
And so what can parents do? It's actually pretty simple. So the first thing they can do is take care of themselves. You'll say to me, I'm too busy, I'm this, and I'm all that. No,
Exactly.
listen.
All them.
So, right, and it's 10 minutes a day of self-care and regulating that nervous system with things like breath work, meditation, yoga, prayer, all those things I mentioned. They can be so impactful. Now, why is that important? You're doing it for yourself. You are going to be a much better parent
Yes.
when you regulate.
Yep.
2, you're going to show your kids how important mental health is. We use grades as a benchmark for mental health for kids, and that needs to end. And I think
Yeah, I
parents right
agree.
now,
I 100% agree. You're comparing
yes,
them to someone else. Like everybody's different, right? With different skills, different, the way they think different. So
right.
I agree.
And you don't have to be a straight A student to be successful. And I have
Yes.
tons of straight A students who have anxiety and depression and are on meds. And people know this. The third biggest thing that parents need to do, aside from taking care of themselves, we have to teach kids coping skills. In
Yes.
30 years, the number one thing that has eroded the mental health of kids is a complete lack of coping skills. They have zero stress tolerance.
Yeah.
I don't care how awesome of a student your kid is. Kids are falling apart over everything.
I
So,
agree.
right? And so instead of when your kid gets a B running to the teacher and yelling at the teacher, you need to teach your kid a way to cope. Our job as parents is to let them be uncomfortable, get
Yes.
them to problem solve about it, so that when big stuff happens in life, they know what the heck to do. This is why we have a world full of stressed out kids. It's not as simple as that. But I'm going to tell you, good mental health is coping skills, which leads to resilience. And that is the anchor of mental health. And it is 100% dependent on parenting
Yes.
and teaching those skills, and really teaching them those coping skills and they can do it. Parents can do it. Simple shifts and language can help them do that.
No, I agree. And a lot of this is going to be laid out in your book. It's going to be okay, right?
Absolutely.
Like,
All
yes.
laid out.
That's perfect. That's
Yes.
perfect. Thank you so much, Dr. Roseann, for coming on the show and kind of educating us on mental health and the different aspects of it, and letting people know, more importantly, that there's so many different roots of mental health and there's so many different ways to treat it. So no, don't necessarily go to your physician or your doctor, whoever is managing you, and expect a pill. There's other ways to get through this. She lays it out in her book. It's going to be okay. She has other resources on her website. Where can they find you and get these resources for not only the adults, but also the children? You're an expert in this.
Yeah, you can pretty much find me on every social platform as Dr. Roseann. My website is DR and my name is Roseann. Everywhere but Facebook, I'm Dr. Roseann Capanna-Hodge. So you can go there, you can follow me on YouTube and TikTok. And I'm really out there giving people information because it is so critical that we make this investment of time and
Yes.
supporting our kids, because we all know that things are rough, but we absolutely have to have hope because there are so many ways to help alleviate symptoms.
I agree. Thank you so much for sharing this information. We will also be putting this in the show notes, all of her information. Thank you very much. Thank you.
Thank you.